Hello there guys, welcome back or welcome if you're just joining. This is the part 2 of our video on bone marrow and hematopoiesis. In the last video, we stopped at the differentiated cell giving rise to two lineage, the myeloid and lymphoid lineage. We're starting with the myeloid lineage. The myeloid lineage will give rise to your erythrocytes, your platelets, and your white blood cells. In erythropoiesis, we have your proerythroblasts giving rise to the reticulocytes, which eventually gives rise to erythrocytes. Now, reticulocytes can enter the bloodstream, where they now mature a day or two after to form red blood cells. Now, a blood reticulocyte count can tell you how well your bone marrow is functioning. So, if you have a high reticulocyte count, you can tell that, okay, the bone marrow is compensating for anemia or hemolysis. But if you're having a low reticulocyte count and you're having anemia, then there's definitely a problem with your bone marrow. So most likely bone marrow failure. Now for platelet formation, which is known as poiesis, you have the last form cells known as megakaryocytes. These cells will extend cytoplasmic arms into the blood vessel. Now as blood flows, it breaks these arms into fragments. These fragments are your blood platelets. While leukopoiesis will form granulocytes like your neutrophils, eosinophils, and basophils, and agranulocytes like your monocytes, which will eventually become macrophages. Next up, we have the lymphoid lineage or lymphoid branch. Now, this branch produces the B cell, T cell, and NK cell, natural killer cells. Now, these cells are produced in the bone marrow and enter circulation, though the B cell stays in the bone marrow and produces antibody. The T cells, on the other hand, they go to a university, which I call mother university, where they are trained and 2% of those cells survive and becomes your body CD4 cells or CD8 cells. So how is this thing regulated? Your kidney detects low oxygen and your liver will detect low platelet levels. So they produce erythropoietin and TPO, erythropoietin. Now this causes your bone marrow to increase production. And once there's increased amount of these things in the blood, the signal is inhibited and as such they stop producing EPO and TPO. Now this entire system can fail in one of two ways. Either you have hypocellular bone marrow, as in aplastic anemia, or hypercellular bone marrow, as seen in leukemia or proliferative disorders. Now, a quick summary. The bone marrow didn't start when hematopoiesis. It starts first in the yolk sac, then the liver will focus into the bone marrow. And the bone marrow is protected by the bones, which adapts to stress with the help of trabeculae. And this whole process is tightly regulated and it is controlled by the law of supply and demand.